Yeah, this is for me a very important study because it exemplifies a little bit the concept of personalized medicine in Parkinson's disease, because we started from a very rare mutation in Parkinson's disease, which is a homozygous mutation in the so-called DJ-1 gene, which causes a loss of protein at the end. And due to that loss of function, people get Parkinson's disease at a very early age. That can be before the age of 40. And what is interesting in that regard is that in our patient, it was not due to a kind of deletion that deleted the gene, but it was a splicing defect that we were not aware. The mutation was formally predicted to change an amino acid in the protein, and we could show that it essentially leads to an exon skipping, and that leads to complete loss of the protein. And using now a genetic approach and also pharmacological approach, we could rescue. We could bring back the protein, we could bring back the exon, and that helped to reconstitute the normal function of dopaminergic neurons, the normal function of mitochondria. And we could even use mini brains based on stem cell models we derived from the patient. And in these mini brains, we could see if we treat these with the compounds that should bring back the exon correct for the splicing defect, we could show that we can maintain dopaminergic neurons to the normal level. Normally, that would degrade. And that opens, of course, opportunities for precision medicine in the future, which is even more interesting because the type of mutation, splicing mutations, are overrepresented in Parkinson's disease patients compared to healthy controls in brain-expressed genes.